So first is, what is synchrony? Synchrony means that I already discussed about patient want to initiate the breath. At the time the ventilator has to give the breath. If that means that there is a trigger synchrony. Ventilator want to, the patient want to terminate the inspiration, the ventilator also has to terminate the inspiration. If it is occurs, it means that there is a trigger and cycle synchrony occurs. So, if example, this is the neural. Okay, here patient want to initiate the breath. This is the muscle, the pleural pressure. So, at the same time, what happened? The patient also generating a negative pleural pressure. At the same time, the ventilator is giving the flow. If example, if it occurs all in the same time, which means that synchrony. If example, this is the patient want to give inspiration. At that time, the ventilator is not delivering a flow. It is initiating the flow. It's here. There is a time delay will occur, which is called asynchrony. So, base synchrony means the patient's respiratory effort and the ventilator's breath should be synchronous at the same time. Then only it's called synchrony. If there is anything is mismatch or inappropriate, it may be ventilator breath is before after the patient's inspiratory effort, which is called asynchrony. So, how can we identify at the bedside? So, I already showed in the previous slide, to identify that we need a neural diaphragmatic activity, is called NAVA catheter. For that, we need a esophageal pressure or respiratory muscle electromyography. If you want to know the ideally to assess the patient ventilator interaction, to assess the synchrony, we need a esophageal pressure. Usually, through the esophageal pressure, we can measure a pleural pressure. They used to place a esophageal catheter at the lower 1/3 of the esophagus. From that, they can measure a pleural pressure. Then, to assess that respiratory muscle work, they has to the electromyography. But most of the ICUs or most of our ICUs doesn't have this advanced esophageal monitor electromyogram to assess the asynchrony. For that, what is the alternative to that? For the alternative for esophageal pressure monitoring or NAVA catheter or respiratory muscle electrocardiogram, we have some other monitors. Most of the modern ventilators will give continuous real-time information about the patient respiratory mechanics through a waveforms and the flow volume curves or pressure volume curves. So, here this most commonly that most of our modern ventilators will give the 3 scalars. Scalar means that there is a one control variable over a time. Here it is a flow waveform, flow scalar. Flow scalar against a time. This is our pressure scalar. This is our volume scalar. So, how can you differentiate it is a pressure, volume or flow? The flow used to be biphasic. See here, there is a positive waveform and negative waveform. The pressure and volume waveform used to be, there won't be any negative waveforms. Based on that, we can identify it is a flow waveform or pressure waveform. Most likely, the flow waveform has the biphasic waveform, inspiration and the expiration. So, based on these informations, we can identify the asynchrony or synchrony. Based on that asynchrony, we can adjust based on what type of asynchrony, we can adjust the ventilator settings. So, why it is important? What is our understanding about the ventilatory waveform is not as expected. See here in this Joint Commission of Regulation of Health Organization report, they found that over 10 years they observed from 1995 to 2003, they found that what is the reason for the ventilatory related deaths? They found almost 80% of the ventilator related death is contributed by the human error. So, in the human error, you see here, it's predominantly contributed by the orientation and training of the healthcare workers about understanding about the ventilator. It is predominantly, we are very poor in understanding of ventilatory waveforms. So, for understanding the ventilatory waveform is very important to prevent the ventilator related deaths.